Since July 25th, when health officials announced the death of the Liberian Sawyer from the Ebola virus disease, 3 Nigerians who had direct contact with him have now died. 6 others confirmed to have the virus are isolated here and undergoing treatment. Apart from working hard to prevent the spread of the virus, health officials are racing to save the lives of those in isolation.
In the last press briefing, we told you of a Nigerian scientist who have already offered the country one of the experimental drugs, the nona-silver. We follow all the protocols as governed by the National Health Research Ethics Code of this country in using the nona-silver as part of the treatment regimen.
Like all the Ebola experimental drug, nona-silver has not been tested on humans before. It is produced by American Dr. Rima Labo. She recently wrote an open letter to presidents of the countries affected by the Ebola virus, vouching for the efficacy of her medicine. But the United States Food and Drugs Administration has expressed concerns over the drug, saying it cannot provide information on its Ebola claims. But head of the Nigerian Pharmaceutical Society says in the light of the danger Ebola poses, using the experimental drug may not be a bad idea.
We have a situation that is akin to the devil and the deep blue sea. So people want to take a plunge, especially if there is hope that administering these products can sustain life for some more years, even if it is at the risk of some degenerative diseases or consequences in future. Even in healthcare, you weigh there is what you call a benefit-risk ratio in administering routine drugs in subclinical disease states. And I guess that's the stage we're here. So if that's the only option left and the client is comfortable with it, I guess we have no other option than to administer these products.
Olumide says his pharmaceutical society does not have any experimental drug in the offing at the moment, but working and coming up with locally made hand sanitizers to aid prevention.
We're trying to come up with a homegrown initiative and solution at the level of the Pharmaceutical Society of Nigeria. We're making contacts now with our community pharmacists who are grounded at community level to begin to look at coming up with extemporaneous preparations.
Health officials here are racing against time to find a vaccine or drug for Ebola. The government has already set up a team of medical scientists to come up with a possible homegrown vaccine. That team has since set to work, but so far it has not come up with something very significant yet. Everyone is now waiting to see what impact the nona-silver drug would have on the Ebola patients being treated here in Lagos. Deji, Badmus, CCTV, Lagos, Nigeria.